Hi everyone, you're all very welcome to this parent information talk on supporting your child in regulating their emotions. This talk is presented by the Mayo Primary Care Psychology Service and it's an information talk suitable for parents of children and teens of all ages. So, an overview of what we're going to look at through this talk. We're going to focus on what is emotional regulation, why it's important, how does emotional regulation develop. Then we're going to take a look at emotional dysregulation, and then we'll focus on the strategies to help your child learn to regulate their emotions. At the very end, then we'll go over the take-home messages or the main points in the talk. So first and foremost, what is emotional regulation? Emotional regulation is the ability to control our responses to arousing situations. Emotional regulation is the ability to manage our emotions and behavior in accordance with the demands of the situation. And it's a developmental achievement. So we're not born with emotional regulation, we learn it. It's a set of skills that we learn, just like how we learn to walk, talk, and eat. So that's a really important point to make there, is that it's a developmental achievement. So we learn how to emotionally regulate. So it includes the ability to resist highly emotional reactions to upsetting situations and the ability to calm yourself down when you get really upset, and also the ability to adjust to a change in expectations and to handle that frustration. So when you're small, we all cried uncontrollably if we didn't get our own way or if we needed to be fed or things like that. But as we grew older, we learned emotional regulation. So now we know how to react more appropriately when things don't go our own way. And emotional regulation can also be called self-regulation. What does emotional regulation look like in children? So this is just some of the highlights. So a young baby with a wet nappy expresses her discomfort by crying. A frustrated toddler has a temper tantrum. A school-age child may get upset but not have a tantrum as they are developing the skills to manage their own feelings and behaviour. And many of us will recognise that teenagers, they tend to go back to square one, and there is a reason for that, which we'll talk about in a little bit. So just looking at this list here, you can see as a baby, the only way they know how to regulate is to cry and have these highly emotional responses. And then toddlers tend to have these temper tantrums. They have developing language skills at that age, and they're gradually learning to put words on their emotions. And then school age children, there's a greater responsibility on them for their own emotional regulation, and they have the ability to separate their internal feelings from external expressions, so they have more control over their emotions. But then the teenage years, as I said, they may regress almost to the preschool years, and there is a good reason for this. More specifically, then, what does emotional regulation look like during early childhood? So, in infants, emotional regulation is shifting the attention or averting their gaze when they're overwhelmed, and they may self soothe by sucking their thumb or a pacifier to reduce distress. And these behaviours are necessary for the baby to process interactions with others and to regulate themselves so that their immature nervous systems are not overwhelmed. And a lot of research has studied these behaviours, and you may recognise them yourselves. When you're holding a baby or an infant and engaging with that baby, at first they're very responsive back to you, towards you. So they might smile or coo or make noises or try to move their legs and arms. But at a certain point, then this behaviour decreases, and the infant may seem almost disinterested in you. And this is the infant's attempt to self regulate when they're feeling heightened emotions. So they're feeling too excited, so they look away from you, or they may seem disinterested. And that's the infant's way of emotionally regulating at that age. In toddlerhood, then, toddlers can focus their attention for short periods, they can adjust their behaviour to achieve goals, they can begin to label feelings, they can briefly delay gratification so they know how to wait their turn for something, and they know to turn to adults for help with strong feelings. So as we get slightly older, we learn to emotionally regulate better. So as babies, remember the only way they can emotionally regulate is by looking away. And we'll all recognize these behaviors in your children from when they were younger. You may also notice at this age that toddlers may become frustrated at not being able to explain what they want or need because they have that developing language, but they don't have all their words yet. And from ages 1 to 3, toddlers are beginning to separate emotionally from their main caregiver, and they're beginning to develop a sense of themselves as independent beings. Then in preschool or early school age children, what does emotional regulation look like? They can recognize a growing array of feelings in themselves and in others. They can identify solutions to simple problems on their own. They can focus their attention and persist on difficult tasks for increased lengths of time. They start using perspective taking, and they show signs of early empathy, and with support using strategies like deep breathing and self-talk, they are able to calm themselves down. So as children start school, they do learn to see things from other people's perspective, so that's the perspective taking element there. And they start to learn empathy, which basically means they understand how other people feel. And then what does emotional regulation look like in the older school age years? So by school age years, your child is likely to be better at planning. They can imagine the consequences of their behaviour and decide how to respond. For example, your child might start being able to disagree with other people without having an argument. At this age, your child is learning to see both sides of a situation. When they can imagine how somebody else sees and feels about a situation, they're more likely to control how they express their own wants and needs. So then what does emotional regulation look like in children, in teenagers, excuse me? Emotional maturity takes a long time to develop fully. The brain only reaches an adult state in a person's early 20s. During adolescence and puberty, the brain is flooded with hormones which heighten the experience of emotions, which in turn makes them very hard to manage again. So, this is what I meant by they tend to go back to the preschool years almost. So these chemicals they first flood the brain at around age 2, and that's why we have the terrible twos. And then they flood the brain again during puberty, and all hell tends to break loose at this age. So this is why it seems like teenagers revert back to their younger years. But it's useful to know this information because they are less in control of their emotions in the teenage years. But it's not their fault. Their brains are getting flooded with these chemicals. So during adolescence, so from ages 11 to 15, the areas of the brain that seek rewards and process emotions are more developed than the areas that are responsible for good decision making and future planning. And this may be why it seems the teenagers regress to their younger years emotionally. They are being led by their emotions and by impulse at this age. So why is emotional regulation important? We'll take a look at that now. Supporting emotional regulation development in early childhood is an investment in later success because stronger emotional regulation predicts better performance in school, better relationships with others, and fewer behavioural difficulties. So, this isn't rocket science. Being able to control our emotions in different situations will make us better able to perform in school, better able to perform in our jobs, and have better relationships with others because we'll be easier to get along with and better behaved as well. And the research backs this up. So, psychological research has shown that high levels of emotional arousal disrupts the capacity to think. So, I've mentioned this in the other talks that we've uploaded. The primitive brain takes over and our executive functions shut down. So we're not able to plan or control or to pay attention. So it's important for us to be able to regulate ourselves to avoid letting the primitive brain take over whenever we feel strong emotions. And if you're interested in this idea of the primitive brain, I'd urge you to take a look at the anxiety talk that we've uploaded also. So then again, why is emotional regulation important? Emotional regulation helps your child to learn at school, behave in socially acceptable ways, make friendships, become more independent, and to manage their stress. So, learning at school will become easier for children that have good emotional regulation because they have the ability to sit still and to listen in the classroom. And there again they behave in socially acceptable ways because they have better impulse control, so they're not just going to burst out into loud comments in the middle of the classroom. They will be able to sit and listen, and again they'll be able to make friends because they won't have these strong emotions, or they won't express their emotions in inappropriate ways such as snatching toys off other kids. They become more independent because it gives them the ability to make good decisions on their own, and they can manage their stress. It helps them to learn that they can cope with these strong feelings, and it gives them the ability to calm themselves down after getting angry. And again, none of this is rocket science, but it's important to note that the research backs this up. So, how does emotional regulation develop then? If we look at this graph here, we can see that there's multiple factors that contribute to the development of emotional regulation. So biology, the blue circle there, biology sets the stage for emotional regulation readiness, after which more complex skills and motivation for emotional regulation develop, and that happens through interactions with caregivers and the broader environment over an extended period from birth into young adulthood. But before we talk about emotional regulation development, we'll touch on the biology bit and specifically the nature of emotions. So, emotion is defined as a complex state of feeling that results in physical and psychological changes that influence thought and behavior. Emotions can be positive or negative, and some emotions are considered to be present from birth. So, that's emotions such as happiness, sadness, anger, and fear. And other emotions we learn over time. So, we learn the feeling of pride and the feeling of jealousy. So this is the definition of emotion here, and a lot of research has gone into figuring out what emotions we're born with and what we learn. And the general consensus is that we're born with those 8 primary emotions that are wired into our brains from birth. That's anger, sadness, fear, joy, interest, surprise, disgust, and shame. They're the emotions that we're born with, and all other emotions we learn over time from others and our interactions with the environment. So we learn things such as pride, jealousy, satisfaction, amusement, those kinds of emotions. So emotions are linked to thoughts and behaviors. In younger pre-verbal children, thoughts do not typically feature in this equation. So for example, if a toddler is denied something, he'll get angry and immediately hit out or start to cry. And as children get older and develop language, thoughts come online a little bit more and begin to bridge the gap between emotions and behaviors. So, as I mentioned earlier, toddlers are beginning to separate themselves emotionally from their main caregivers and are developing a sense of themselves as independent beings. And as toddlers become more independent, they may tend to get angry when they're denied something. So now we're going to take a look at the emotional triangle, and this is just going to show us the connection between our thoughts, feelings, and behavior. And we're going to look at this in a little bit more detail now. If you are interested in this link between thoughts, feelings, and behavior, we do focus a lot on this concept in our parent information talk on anxiety. So you're very welcome to take a look at that talk if you're interested in that. So if we take a look at an emotional triangle for fear, so let's say we let's say we're afraid of dogs. So the situation is that you're walking down the street and you see a big dog across the road. So the thought that you might be having there is that dog's going to run over here and he's going to bite me. I'm in danger. So that's the thought that you're having, that you're in danger. Then you're going to experience a feeling. So you may start to feel sick or your palms will start to feel sweaty. You'll have a general feeling of fear. And that's going to lead to a behavior. So you're probably going to cross the road or run away as fast as you can to get away from the dog. So that's the behavior then. So this highlights the relationship between our thoughts, feelings, and behaviors, which is key to understanding why we react emotionally the way we do in certain situations. So now we're going to take a look at the emotional triangle for anger. So let's say the situation is that you've been in the car park going into the shop and you've been queuing for a particular parking space and somebody comes along and takes that space even though you were there waiting for it. So what thought might be going through your head? What's the emotional message that you're receiving? The message might be, what's he doing? This is really unfair. I've been waiting for that space. And then that's going to lead to a feeling. So you might feel anger or rage at being treated unfairly, and that's going to lead to a behavior. So perhaps you might shout at the person or you might beep your horn at the person. So this is highlighting the relationship between our thoughts, feelings, and behavior, which is key to understanding why we react emotionally. We'll look at one more now. So we'll take a look at an emotional triangle for sadness. So let's say if you have a teenage girl and she finds out that a few of her friends have gone to the cinema without her. So what thought might she be having there? She might be thinking, they hate me, they don't like me, I have no friends. So that's the emotional thought that she's receiving, is that she has no friends, and the friends that she thought she had don't even like her. So that's going to lead to a feeling of sadness. So she's going to maybe feel unwell. She might feel a little bit sick, or she may begin to cry, or she just may not feel very good. Just a general feeling of sadness, and then that's going to lead to a behaviour. So she may become very, very upset and very, very emotional because of the emotional message that she received that her friends don't like her. So now we're going to take a look at this idea of a window of tolerance. So, emotions are linked to thoughts and behaviors, which we've just discussed, but not all emotions result in intense physical experiences or extreme behaviors. Depending on our own temperament and emotional learning, our ability to tolerate difficult emotions will be different. A useful way to think about how we experience and manage our emotions is through the window of tolerance. So, how we react to situations will depend on our own temperament, which we can't change, and our emotional learning, which is what we've picked up along the way from other people around us, so our parents, etc. But we can learn new ways to cope with our emotions. And as mentioned earlier, emotional regulation is a skill, so we can develop this at all ages. It's never too late. The window of tolerance is a simple idea that says we all have a comfort zone where we can manage our emotions productively based on how intense the emotion is. So think of it like a Goldilocks zone where emotional intensity is just right. It's not too high and it's not too low. Most people are in the comfort zone most of the time. However, we all come out of the zone from time to time. But this is quite a busy slide here, and it just shows the window of tolerance. And again, it's the term used to describe the zone of arousal in which a person is able to function most effectively. So we have the hyperarousal zone there. That's the fight or flight response, which we also discuss in detail in the anxiety talk. And that's where we're receiving too much arousal. And you can look at the signs that you're in the hyperarousal zone. So you may feel tense or shaky. You may feel very emotional, defensive. You may have racing thoughts. And then below that, we have the optimal arousal zone, which is the window of tolerance. And how do we know that we're in our window of tolerance? We can feel and think simultaneously. We experience empathy. All feelings are tolerable in this zone. We're in the present moment, so we're living right here, right now, and we're feeling open and curious. And we're aware of boundaries, and reactions adapt to fit the situation. And we also feel safe. So, this is where we're trying to be. And then below that, we have the hypoarousal zone. So when you're in this zone, you may have an absence of sensation, you may have no energy, you may feel like you're not really there or you're numb. So these are just to show the highlights of the different zones. And the zone that we're aiming to be in is the window of tolerance, which is the optimal arousal zone. So during times of extreme stress or heightened emotions, we do experience periods of either hyper or hypoarousal. And again, the hyperarousal stage is also known as the fight or flight response. And that's characterized by hypervigilance or feelings of anxiety and panic. And then hypoarousal is the freeze response. And this may cause feelings of emotional numbness, emptiness, or low mood. Some people will have learned very effective ways to stay in the zone and avoid the extremes of feeling too much or too little. Others will have more difficulty with this and tend to fall out of the zone and react with unhealthy strategies more often. And this goes for all of us, both adults and children. And again, later on, we're going to look at strategies to help us and our children stay in the window of tolerance more often. So back to how does emotional regulation develop? So we've just mentioned that some people can stay in their window of tolerance more often, which leads us to wondering how does emotional regulation develop? And as we mentioned previously, it's a mixture of biology, skills, motivation, and caregiver and environmental support. And we'll look at these factors now in a moment. So how quickly can children learn emotional regulation? So similarly to toilet training or learning to walk and talk, how quickly children learn emotional regulation can vary from child to child. And research has found three possible contributing factors to how quickly children can learn emotional regulation. The first factor there is neurological maturity. So the growth and maturity of the child's nervous system provides the hardware required for emotional control. The second factor then is a child's temperament or their developmental status. So children with learning difficulties or language delay or attention difficulties are more vulnerable to emotional dysregulation. And we're going to talk about emotional dysregulation shortly. The third factor then is parents and environmental support. So differences in how families talk about feelings impact on a child's developing emotional regulation. And home life can also have an impact on this. So children who experience chronic stress or may lack stability in their home environment can have problems with emotional regulation. Whilst we can't change a child's neurological makeup or their temperament or developmental status, parents and caregivers can help their child's emotional regulation by that third factor there. So, parents and caregivers are key in teaching a child emotional regulation. So, parental influence on emotional regulation. There is a well established link between parenting and the development of emotional regulation in childhood. As indicated by almost 50 studies, parental warmth, responsiveness, and sensitivity support emotional regulation development and may buffer the effects of other stressors in the family and environment. And again, we're going to go through some tips on how to increase your child's emotional regulation later on. But the research does suggest that parents are the key to teaching children emotional regulation. So I mentioned briefly their emotional dysregulation. So now that we know what emotional regulation is, let's have a quick look at emotional dysregulation. If someone has trouble managing their emotions over a long period of time, this is called emotional dysregulation. This can lead to mental health issues such as anxiety and depression. Fortunately, we can learn to manage our emotions in healthy ways at any stage of our lives. So it's important to note here that just because one of your children might be difficult some of the time, this does not mean that he or she is emotionally dysregulated. Emotional dysregulation occurs when someone has trouble managing their emotions consistently over a long period of time. There is a common misconception that emotional regulation needs to be taught in childhood or else it's too late, but actually it's not too late to make a difference in the adolescent or the young adult years. Research has now shown that there are major changes in the brain architecture that occur during adolescence, making interventions at this age important and timely. So it is positive to note there that emotional regulation can be taught at any age. And this goes back to the fact that it's a skill that we learn, not something that we're born with. And as we all know, we can upskill at any age. So, what does emotional dysregulation look like? For some children, it's instant, they have a huge, strong reaction, and there's no lead in or build up. And for other kids, distress seems to build up and they can only take it for so long. Eventually, it leads to some sort of a behavioural outburst. The key for both types of children is to learn to handle those strong reactions and find ways to express their emotions in a more effective and less disruptive way than having a meltdown. And this probably looks familiar to some of you. Perhaps if you have more than one child, you can see the difference in how they act emotionally. So some may have a huge, strong reaction almost immediately, while others it takes a little bit longer and distress builds up over time, and then they'll have an emotional outburst. And again, we're going to look at strategies shortly on supporting our children with their emotions. When a child doesn't learn appropriate emotional regulation, they can take on maladaptive strategies instead. And some of these are avoidance of emotion, acting out, withdrawal, aggression, sometimes excessive social media use or excessive gaming. Self harm is another one, or alcohol and drug use. But again, it's really important to note that most children are able to regulate their emotions some or most of the time. And emotional dysregulation only occurs when they consistently cannot manage their emotions over a long period of time. So now we're going to take a look at the strategies to help your child learn to regulate their emotions. And we're going to take a look at this idea of co-regulation here. So what is co-regulation? It's the supportive process between caring adults and children that fosters emotional regulation development, and it's called co-regulation. Co-regulation will look different at different ages as children's capacity for self-regulation grows, but remains a critical resource across development. So co-regulation is basically when parents or caregivers help their children with their emotional regulation. Helping a child to co-regulate their emotions using a parent as a guide, and it's necessary at all ages, not just younger children. And what does effective co-regulation look like during in childhood? So in babies require adults to manage a large portion of their regulatory needs, from feeding to temperature control to management of environmental stimuli. So babies, we all know, have big, strong emotional reactions, and they do need adults who are sensitive to their cues and responsive to their needs to provide them with a soothing presence in times of distress. Babies have little, almost no control over their emotional environment. And then toddlers, then caregivers can begin to purposely teach and model skills like waiting, which is a brief delay in gratification, and using simple words to communicate feelings and need. So, toddlers are beginning to build motor and language skills that allow them to control some aspects of their environment. So, they know that they can move away from a loud noise or they can ask for something to eat. But they do continue to have strong emotions that far outweigh the emerging skills. And then in school age years, teaching and communicating clear rules and expectations and using consistent natural or logical consequences provided firmly but calmly. So at school age, developmentally, they're much more prepared to learn and use self regulation skills. And likewise, their growing language skills during the school years allow children to use words in managing their thoughts and feelings, and they know how to ask for help. And this age, it's a perfect time for caregivers to actively teach and coach skills like emotion identification and problem solving and calm down strategies. And we will take a look at those strategies shortly. So when you are teaching your children in emotional regulation, they do need considerable repetition and prompting and practice when they're using these new skills. This is the strategies on supporting your child with emotional regulation. Co-regulation breaks down into three main areas. So the first circle there you'll see is providing a warm and responsive relationship. Then below that we have structuring the environment, and then we have teaching or coaching self-regulation skills. And we're going to discuss each of these in turn now. So the first one there is providing a warm, responsive relationship. Providing a warm, responsive relationship where children feel respected as individuals, comforted and supported in times of stress, and confident that they will be cared for no matter what. This positive relationship will promote self efficacy and allow children to feel secure enough to practice new skills and to learn from their mistakes. So, self efficacy there, it's the belief that we have in our ability to succeed with a specific task. So, this is the first area, it's providing a warm, responsive relationship. And how do we do that then? How do we provide a warm, responsive relationship? Acceptance is a key to providing this relationship. So accept your child's emotions and responses and remember that it is not a deliberate attempt to make your life difficult. It's normal for a child to sulk or to shout or withdraw at times. The important thing is to tune in and understand your child's emotional state, which will help your child cope and tolerate increasing amounts of emotional tension. Provide encouragement, be positive, and always praise. So we do talk about the concept of attunement and tuning in and another talk that's uploaded on attachment. So if you're interested in learning more about tuning in or attunement, I would advise you to have a look at the attachment talk. And attunement is one of the keys to forming a warm relationship with a child. It's important to note that it doesn't happen overnight. It's a process of getting to know your child, and it begins with trial and error. So, trying to figure out what a child wants and what a child needs. And we may not always get it right. So, at birth, if you can think back to when you first had your baby, you couldn't tell the difference between the various cries a baby uses, but within a few months, you're able to tell the difference between a hungry cry, a tired cry, a cry for attention. So that's tuning into your baby, and we can tune into our children at any age. And a good way of tuning in is using expressions or sentences like, sounds like you're feeling angry. So if you're talking to your child and they're upset or they're angry about something, feed that information back to them to show that you're listening. So it sounds like you're feeling angry, or so if I hear you right, you're saying that you feel really upset with her. So what you're saying is, let me see if I understand you. Using sentences like that lets your child know that you really are listening and you're really interested in what they have to say. So now we're going to take a look at structuring the environment. This is another area that we're going to be looking at to develop emotional regulation. So structuring the child's environment. And structure and routine are extremely comforting to children and teenagers, as their worlds are often very chaotic, particularly in the teenage years. So, how can we structure the environment? It just means creating an environment that is physically and emotionally safe for children to explore and learn at their level of development without serious risk to their well being. Consistent, predictable routines and expectations promote a sense of security by providing clear goals for behaviour. And again, we focus a lot on creating a physically and emotionally safe environment in our talk on attachment. So, if you are interested, I would encourage you to tune into the other parent talk on attachment. So, how can we structure the environment? Having consistent limits on what's okay and what's not okay, having clear household rules, having predictable routines, so meal times and bedtimes at similar hours each day, having clear expectations. So, this is how we or I expect you to behave in this house. And this is just some of the ways to ensure your child's environment is structured and predictable, which encourages those feelings of calmness. And just the key for structuring the environment is to be reliable and consistent with that. So when we say reliability, that means when you do what you say, and consistency is when you respond the same way you have in the past. And again, we focus on this in the attachment talk. We talk about good enough parenting, which is being reliable and consistent 80% of the time. So it's not possible to stick to our rules and routines rigidly 100% of the time, but 80% is good enough. And the third, and arguably the most important area to teach emotional regulation, is teaching your child the skills to self regulate. And we're going to look at this through the concepts of modeling and opportunities for practice. Naming and talking about emotions. So, the aim here is to teach control over behavior, not control over feelings. It's important for children to know that all feelings are normal and okay, but it's not always okay to act out on our feelings. Help children label their feelings and encourage the child to talk about that emotion. Teach them that people have different feelings about the same event. The crucial lesson here to teach our children self regulation is that all feelings are okay. So avoid saying things like, don't be sad, or you shouldn't be angry about that. Instead, label the child's feelings accurately and encourage the child to talk about that emotion. So instead of saying, don't be sad about that, say, you seem to feel quite sad about that. Why is that? And have a discussion around that. Children need to understand that people have different feelings about the same event as well, just like one child might like broccoli and another child hates it. So, the crucial lesson is that all feelings are okay. Some feel nice while others are uncomfortable, but they're all real and they're all important. So, continuing on from naming and talking about emotions, the next step we're going to look at is self awareness, or name it to tame it. When we're mad, irritated, afraid, or worried, our brain thinks we are in a dangerous situation and our body changes to address this potential danger. Some of these changes include rapid heartbeat or breathing, redness in the face, clenched teeth or clenched fists, raised voice, tight muscles, upset stomach, a headache, or feeling fidgety. And it's important for our children to recognize the changes that may accompany their strong emotions. And when your child notices these changes to their body, they can identify strong emotions better. And you can help them with this by helping them to label their emotions or name it to tame it. You can also model this by labeling your own emotions in an age appropriate way. And by doing this, you'll help your child recognize these emotions in themselves. So, saying things like, I'm feeling really frustrated at the moment because I was hoping to get the shopping done today, but now I have to work late instead. Or things like, I have a big presentation at work today. I feel the butterflies in my tummy and my hands feel a little bit sweaty, so I know I must be getting a little bit worried. And that is just building on that self awareness and naming it to tame it. Another strategy is to teach appropriate negative feelings. So, teach your child appropriate ways to express negative feelings. Children need to know that all emotions are okay, but that they have a choice in how they react. So, sadness, anger, frustration, anxiety are unavoidable and normal, but there are different ways of expressing these emotions, and children have a choice in how they react. We can help our children learn the difference between sticking up for themselves and attempting to hurt somebody else, and praise them when they express difficult emotions in appropriate ways. So, for younger children, you could use a chart, create a chart of things that your child likes to do. So, go for a walk with mum, or listen to their favourite song, or read their favourite book. And you could start by making this chart with your child and sticking it on the fridge, so that when your child is feeling a strong emotion, they can go to the chart and pick an activity to do. And that's just going to teach your child appropriate ways to feel these negative feelings. Encourage positive self talk. And self talk is the underlying thoughts which can cause emotions. Research shows that children with negative self talk get angry more easily than children with positive self talk. Teach your child to use helpful thoughts to calm them down and gain control over a situation. As a child develops, he or she begins to have a capacity for an internal dialogue. We all have this internal dialogue or self-talk. And as I said earlier, we all have underlying thoughts that cause us to feel certain emotions. So if you think back to the emotional triangle for anger or fear, these thoughts we have are known as self talk, and sometimes children express their self talk aloud. So, for example, a child that feels discouraged may say out loud, I never get anything right, or I never win anything. But you can teach your child to use helpful thoughts that calm them down and gain control over a situation. So you can teach your child to quietly think to themselves, I'm not going to let this get to me. With more practice, I'll get it, or I'm able to do this. And that just turns the negative self talk into positive self talk. Encouraging positivity is another way to build emotional regulation in our children. So, encourage your child to see themselves as someone who is good at handling emotions. You can predict your child's success by saying things such as, you're becoming a person who can really control their anger well. You're so strong inside. And this is really effective for children. The more you tell a child they're good at something, the sooner they will believe it. So, you can praise any attempt at emotional regulation. So, for example, if one of your children is getting frustrated with their brother or sister, praise them if they come to you rather than lash out at their sibling. Talk about experiences with your children. So, talk them through conflicts with their friends and each other, and encourage decision making that is consistent with your values. Model through your own interactions with them and with others, and you can help them think about the conflicts of characters in books and shows in order to talk about these experiences. And this is especially relevant for older children and teenagers. So, sitting down with them and talking to them about their conflicts with their friends. And you could model this in an age appropriate way as well. So, if they're having a conflict with their friend, discuss that with them and perhaps model through your own interactions. So let them know in an age appropriate way of a conflict you once had with a friend and how you dealt with that. And then the last one there that I mentioned about talking through conflicts of characters in books and shows, this is really useful for younger children. So that gets them thinking about conflicts that characters encounters in the books that they're reading. And you can explore those conflicts with your children. It's a really great tool to get our kids thinking about how other people feel and experience emotions as well. Teaching problem solving is another one. So, identify typical situations that may lead to emotional meltdowns and use them to teach problem solving. Generate several possible solutions to a problem. Use encouragement. Show them that there are consequences to their solutions, and reinforcement through praise. So this is basically explicitly teaching our children how to problem solve, and it builds emotional regulation and also resilience. And the basic idea is to teach your child to generate several possible solutions to a problem and be encouraging. And when it looks like they're getting stuck, you can also offer up solutions as well. So, next, you can ask your child to think about the consequences of the solutions that they came up with. And you can help him or her to understand that, for instance, if he hits his sister to get his bike back when she's taken it off him, he might get into more trouble than if he didn't hit his sister. And reinforce all efforts at problem solving with praise. And this is useful for younger children and also for teenagers. So we'll just look at a quick example of this. So let's say we have a child who's prone to meltdowns and his sister takes his bike off him. So sit down with him and say, okay, let's have a look at this problem and let's come up with some solutions. So how can we fix the problem? So what can they do the next time this happens? So what can you do the next time your sister takes your bike? So you go through several solutions with him and let him come up with the solutions. But if he's having problems, you can, of course, help him. So the solutions may be things like he can tell you next time it happens, he can hit his sister, he can break his sister's PlayStation to get her back, or he can choose to play with a different toy. They're the kind of solutions that you'll probably encounter. And then after you've came up with the solutions, you need to look at the consequences of each solution. So we'll go through the list of solutions again with him. So what will happen if you tell your mother? Well, your mum might be able to help you with that situation. She might be able to ask your sister to give you the bike back. So what's going to happen if you hit your sister or you break her PlayStation? Your mum or your dad's probably going to get really mad at you and you might be grounded and you definitely won't be allowed on the bike then. And what's going to happen if you choose to play with a different toy or play a different game while your sister's using the bike? You'll probably have fun and you can play with the bike later or after your sister's finished. So this is just teaching very explicitly problem solving with children, and it is very useful with teenagers as well. Another technique particularly useful for younger children is the turtle shell technique. So, this is teaching your child to retreat into an emotional turtle shell to calm down. And it helps them deal with the neurological or biological aspects of emotional arousal. And it's a good first step to use before using the problem solving step for younger kids. So, before you do the problem solving that we've just spoke about, it is useful to use the turtle shell technique to calm them down first. So, positive self talk, which we mentioned, and the problem solving strategies help your child deal with emotional regulation on a cognitive level. So, that's a thinking level. But they sometimes need help dealing with the biological level of emotional arousal first. So, most children work themselves up so much that they have no control over their self talk and they can't take part in problem solving when they're all hyped up and emotional. So if you use a technique like the turtle shell technique, it should calm them down first. So you can ask your child to imagine that they have a shell, like a turtle, that they can retreat into. And next, teach your child how to go into their shell. So take 3 deep breaths and say to yourself, I can calm down, I'm okay, I'm good at solving problems. And you can tell your child then that she can stay inside her shell until she feels calm enough to come back out again. And it's helpful to model this technique for your child as well. So, for example, if you're in the car park and someone steals your car parking spot, you could say, oh, I'm so mad at that person. I was waiting first for that spot. Oh, well, I better go into my turtle shell for a while and calm down. And you can do that then. Breathe deeply, take 3 deep breaths, and say to yourself, I'm okay, I can calm down, I'm good at problem solving. And then afterwards say, well, now I feel better, I'm going to look for another spot. So that just shows your children and it models to your children using these techniques to calm down. And again, the turtle shell technique is more useful for younger children. Teaching your child awareness is another strategy, so helping your child become aware of the stages that build up tension. The first early warning signs of temper tantrum or outburst are very familiar to parents, and the turtle shell technique can then be implemented. So typically there are 4 stages to a child or teenager's emotional outburst, and you'll recognize these in your own children. So stage 1, the child is very grouchy or sulking around the house. Stage 2, it seems that no matter what you suggest, nothing seems to satisfy them or make them happy, and an emotional outburst may occur at the slightest provocation at this point. It may seem here that the parent's efforts to control the outburst may in fact make it worse during stage 2. Then we move into stage 3, and this occurs after the emotional outburst. And we sometimes call this the depression stage, where the child feels very sorry for themselves, or perhaps the leave me alone stage, where the child does not want to interact with anybody else. And then we move into stage 4, and this is the final stage, and it's when the child is ready to continue with his or her normal activities and may in fact act like nothing happened. So it's important to intervene at stage 1 if possible. So remember, stage 1 is when the child is feeling grouchy or perhaps sulking around the house, and you can intervene here with the turtle technique. So often children don't realize they're becoming angry or frustrated, and therefore they don't express these emotions until the full blown outburst. If your child is having difficulty expressing him or herself, you can try to put into words what he or she might be feeling. Parental understanding and concern can go a very long way. And it's also possible to intervene in the fourth and final stage, so stage 4, when the incident is over. You, as a parent, can lead the child through problem solving and discussing what happened and how the child might handle it differently next time. And you include things about how you felt during the outburst and how your child felt, the causes and the early warning signs, and alternative ways to deal with it in future. Praise, praise, praise is also key in teaching emotional regulation. So praise your child's efforts to regulate emotions, any and all attempts at regulating emotions. Reinforce any calm behavior after a frustrating event. You can also teach them to praise themselves through positive self-talk, such as I did a good job or I was patient and it paid off in the end. So the key is to be sure to praise children who handle frustration without losing control. The research has shown that aggressive and impulsive children receive less praise and more criticism, even when they are acting appropriately, but they actually need more praise than other children. So for children that are typically difficult or have difficulty emotionally regulating, it's imperative that we give them more praise when they do act appropriately. So reinforce any calm behavior after a frustrating event. So for example, you can say, that was great, you calmed yourself down. That was great, you kept trying even though you were frustrated with that maths question. Things like that. So you can also praise them for even for the slightest inclination of calm behavior. Another way to teach emotional regulation is through scaffolding. So you can coach children through their emotions and provide a supportive framework. This is called scaffolding the behavior you want to encourage until they can handle these challenges on their own. Dry runs are an effective way to scaffold self-regulation. For instance, if you had trouble with a child reacting impulsively or having a tantrum in a shop, make a short visit when you don't need to do serious shopping. Helping children develop self-regulation skills is similar to helping children learn to read or count or ride a bike. You need to isolate that skill and provide practice. When you think of it as a skill to be taught rather than just say bad behavior, it changes the tone and the content of the feedback you give your children as well. So you choose the situation you want to focus on and then break that down into smaller manageable steps. So for example, if you wanted to scaffold a behavior here, let's say one of your children is prone to having meltdowns every time he's asked to stop playing the PlayStation. You can use scaffolding to practice transitioning away from the game. So you can have him practice playing for 5 minutes and then handing you the game for a minute before going back to playing again, and then using rewards if necessary. And if a child has emotional breakdowns at bedtime because he or she doesn't want you to leave the room, you can also scaffold that. So you can stay with the child for 5 minutes, then 3 minutes, then 2 minutes, etc. So scaffolding is just supporting the child in handling these challenges on their own. Modeling self-control is also very important. So children are likely to copy how their parents handle their emotions. As we said, it's helpful to talk about your emotions and how you cope, and always aim to stay calm. Children are likely to copy how their parents handle their emotions. So if you often fly off the handle or sulk after you've had an argument, you may notice that your children begin to copy that, and it helps to talk about your emotions and how you cope. For example, if you're trying to fix something in the house or a broken lawnmower outside, instead of exploding in a big emotional outburst, you might say things like, "Oh, I better take a break from this for a while. I'm starting to feel frustrated and I think I'm making things worse." And that just shows your child how you control these negative emotions that you have. And also, staying calm during your child's emotional outbursts is very important, and try to offer calm and soothing words and advice until they calm down. So, self regulation doesn't happen overnight. However, children are very observant, so leading by example will help with their progression a lot. And current research continues to support the belief that a parent's own ability to self regulate has a tremendous impact on their child. So this focuses then on the importance of your own self regulation. Caregivers who focus on improving their own coping and calm down skills will build their own self regulation, provide a more calming influence to children in their care, and be better able to teach these same skills to children as they grow. Caregiver capacity for co regulation will depend on that caregiver's own self regulation skills. Young children are incredibly sensitive to the emotions and behaviours of adults. Adults who are themselves feeling very stressed may have a harder time calming a young child down, and thus they may actually increase that child's agitation, which in turn makes it harder to soothe them. So, your own self regulation is very important when we're trying to teach our children emotional regulation skills. Now we'll look at a few strategies on how to stay calm, particularly for us as parents and for older children. And an effective calming strategy is focused breathing. With focused breathing, you become aware of your own breathing. One example includes counting to 5, taking a deep breath, and repeating until you feel calm. Another example is balanced breathing. And with balanced breathing, you breathe in for 3 seconds and then you breathe out for 3 seconds. And another example is belly breathing. And this is where you put your hands on your stomach and pay attention to your belly going up and down as you breathe. And this is really effective, this focused breathing, but it has to be practiced. So you need to practice this in neutral situations when you're feeling calm already in order for it to be effective in emotionally arousing situations. With practice, we can switch our mental focus from anxiety to concentrated attention on the here and now, and in turn change our emotional responses. And this is known as mindfulness. And you can take the opportunity to lead by example with this. So you can take part in mindful practices at home or in the car or when you're eating together. So, for example, if you're in the car on the way to school or if you're in the car going to football practice, ask your children, what can you feel? What can you smell? What can you see? What can you touch? And you can do this as well when you're eating together and having a meal together. But it does take time and practice for this to be effective. Also, be on the lookout for activities to engage your child. So, studies have shown that mindfulness can have an impact on the emotional part of the brain, which is the amygdala or the alarm part. And mindfulness also makes us better regulators and helps strengthen the connections between areas in the brain associated with executive functions. So, those are things like attention and concentration. And mindfulness is really useful for lots of people, but especially for children with emotional regulation challenges. And another great simple tip is when you're outside your window of tolerance and feeling a very strong emotion, get up and leave the room that you're in. It's very simple, but research has shown that if we enter a different room or a new environment, our brain needs to process this new information, and so it will temporarily calm us down. So, the main take home messages from today's talk on emotional regulation. Emotional regulation is important in all areas of life, so that's school life, home life, friendships, and work. Emotional regulation is a skill that can be taught at all ages. Provide a warm, responsive relationship to encourage emotional regulation. Structure your child's environment and teach and model good self regulation skills. Here are some references and additional reading if you're interested in the topic of emotional regulation. Thank you all for listening, and please feel free to share this talk with your friends and families if you found it useful. Thanks very much.